Everyone, I'm Kathleen Stansberry. I teach mostly in the media analytics program here at Elon University. And one of the things we've been doing this week is I've been working with my media analytics seniors to talk a little bit about how information about coronavirus, particularly the raw data, how it's being shared. One of the interesting things happening right now is that a lot of the data related to coronavirus outbreaks is publicly accessible. And I'm a huge proponent of open data. So in a lot of ways, this is great. But what I'm starting to see is a number of ways that people are communicating information about COVID-19 that may be, while true, while factually accurate, is not actually truthful. In fact, it can sometimes be misleading or even potentially dangerous or offer or provide recommendations that are outside of what's actually safe. So I'll go over a couple examples, and most of these are pieces that were pulled by my students because they are currently scouring the web looking for examples of good sharing of COVID-19 data and not so good ways that COVID-19 data is being shared. So I want to thank my media analytics seniors for helping me gather a lot of this material. So what you're seeing on the screen now, it's probably something you're pretty familiar with. This is the Johns Hopkins site that has been tracking coronavirus outbreaks since really several months now, about 2 months since some of the beginning emergence in China. And unfortunately, as you can see, the US now has the highest number of coronavirus cases in the world. So something that not everybody knows is that all of that data that's being used to populate the Johns Hopkins map site is publicly accessible data. And they have a GitHub. GitHub is a social network people use to share code, to share data sets, to share information that other people in the tech and other techies might find useful. So Johns Hopkins has been posting links to where their data is being pulled from that they're using to populate their visualizations. And anybody can access this, and anyone can download the data about outbreaks and about incidence levels and there's no licensing. You can basically create what you want with it, which has led to great things and not so great things. Another thing to keep an eye on is that we have other companies, Unicast is the for-profit company, I believe, that are also sharing data that they're collecting and then using to share information or especially in this case, this is the Unicast data that's looking at how they're tracking cell phone use and looking to see if, based on location data from your cell phone, whether people actually are social distancing or not. So they're trying to get a sense of if people are leaving the house more or less since social distancing has been recommended. And while there's, again, some positive aspects of this, it's not always taking into account potential ethical issues with sharing people's location data. It's not always, some of the comparisons aren't always accurate. It doesn't always take into account different ways that people use their cell phones. So really just this first assignment, this is one of the first online assignments my students have been doing. It's really meant to get them thinking critically about we have a lot of information available. How can we share that information in ways that are beneficial and both truthful as well as true and also ethical? So I'll give just a couple examples of things my students have pulled that are not always great examples of how information is being shared. So this is a visual that shows number of daily deaths of COVID-19 compared to several other infectious diseases. So the problem here is it's comparing COVID-19 at the outbreak of an epidemic and then using that to compare with several other diseases that are much more, that we've had around for a very long time, that are, we tend to plan for, that our health systems worldwide are able to treat. And it's also not, doesn't show a good understanding of the way that an infectious disease, particularly when we don't have We don't have great methods to prevent the spread of that disease. We don't have a vaccine right now for COVID-19. We don't have good ways to stop that from spreading. It's sort of an apples to oranges comparison. And a visualization like this can be detrimental because it minimizes the potential risk of something like COVID-19, and it could actually have an effect on people's actions if they think it's not actually such a big deal. Another example that's really common is some inaccurate comparisons regarding disease rates. So for example, New York, the state, looking at total overall number of cases in New York and comparing that with France. So this is a visual that looked at that's ignoring all information about demographic information, how these two locations differ from one another, what the age of the populations are, the density of life in those areas, and it's just making a direct comparison, which is, again, true but not truthful. I'm also not a huge fan of the excessive use of the color red, which at least in the United States is it's alarming. It's an alarmist color. And not that COVID-19 is not something to be extraordinarily concerned about, but sometimes that use of red, it's really meant to incite the idea of danger or fear. So I think that's something we have to be aware of and be thoughtful in our use of color in a lot of these visualizations. And lastly, another very common way that coronavirus or COVID-19 outbreaks have been shown is through absolute value mapping, where states are being colored based on, and you can see this countries around the world, so they're being colored based on the number of active cases or the number of deaths or the number of positive results on COVID-19 testing. But what it doesn't take into account is the differing population in different states. So this is an absolute value of total number of cases that have been tested positive in these states. New York, California, Washington, they all are higher population states. They also this kind of map also doesn't take into account the fact that we have differing access to COVID-19 test kits in different parts of the country. So areas that may actually have higher number of people who are testing, or higher number of people who have COVID-19, but have not actually been tested because we don't have the same access to testing materials across the US. So again, it's not that this information is not accurate in terms of what the data says, but the way it's being shared can be misleading. This is an example of a global trends map that I like, and some things to look for when you are looking at different types of ways people are trying to share information about COVID-19. Important things to determine: is it including information about current active cases as well as aggravated cases? Aggregated means that that's going to be total number who have been diagnosed at any time. That's going to include people who recovered and people who passed away from coronavirus, as well as active confirmed cases. So those are cases that are currently confirmed and people are currently undergoing treatment or staying isolated with coronavirus. So it breaks down some of those raw numbers to show some of the important details within them. I also really like that this particular map, I have it on PowerPoint so you can't see it, but when you have it live on a website, you can click in, you can get information about specific areas, and it provides a level of interactivity to allow you to just get a little bit more context for the information that's being shared. And finally, I just wanted to close with one of my absolute favorite visualizations related to coronavirus, and that is the cattening the curve. We have all probably seen the flattening the curve visualization to try to show why it's important to self-isolate or social distance right now. I like the cattening the curve because it takes something that, first of all, it's scary. It's asking us to do something big, and it helps to make this more memorable. It's a little bit amusing, and it's still informative, while still being kind of funny and fun and something that a lot of people want to share. So I've seen this pop up all over the interwebs, which has been great because it's not inaccurate and it doesn't have to be, data sharing doesn't have to be super complex. Think about what information, what message you actually want to get across. Think about whether that message is accurate. Is your analysis of data being affected by your own biases? Do you have I'm not a trained epidemiologist. I don't feel like I'm appropriate to try to make predictions about potential, how many people will likely become infected. That's not my area of expertise. So are you staying within your own area of expertise when you're trying to share information or data? And is it memorable? Will people be able to take something away and understand what you're trying to share? So that's my thought. That's what I'm trying to work my students through right now. And best of luck as we all adjust for this strange and time where we're trying to be creative in how we are helping and being there for one another.